It's that time of the year again, and no, I'm not talking about Christmas, I'm talking about the Wuhan virus pandemic. It's December, and the Wuhan virus is rearing its head again. It's happening across the globe. Cases are on the rise, and the situation is no different here in India. In the last 24 hours, in fact, India has recorded 614 new cases. It's the highest number of new cases detected since May 2021. Kerala has reported 3 new deaths. So there's clearly a surge. And what's driving this? A new variant of the Wuhan virus, it's called the JN1. It was first discovered in the southern Indian state of Kerala in India. In India, that's where it was first discovered. Since then, it has spread to states like Goa and Maharashtra. There are 21 new cases of this variant. The central government held a COVID meeting today. There is no reason for alarm yet, but states have been asked to ramp up surveillance. They must track new strains. The latest one, JN1, is linked to an old variant. You may remember Omicron. It was driving the surge last year. Turns out JN1 is linked to Omicron. It's from the same lineage, but it carries a mutation, something that gives it extra immune-evading capabilities. And that is what makes it contagious. The rise in cases is proof. This strain is highly transmissible. Even if you are double vaccinated, you may still get it. The World Health Organization has called it a variant of interest, meaning they're tracking it. And that brings us to the question on everyone's mind. Is this deadly? For now, the symptoms are generally mild. It includes a fever, runny nose, sore throat, headaches, and diarrhea. Some patients may experience breathing problems, but overall, nothing severe. Individuals usually recover in 4 to 5 days, and the surge is not limited to India. At least 40 countries, 40, have detected the JN1 variant. Many of them have rising cases. In Southeast Asia, the masks are back. Countries like Malaysia and Singapore have issued advisories. They want travelers to mask up. Singapore has recorded 56,000 new cases in a week. 56,000 new cases in Singapore. They want everyone to vaccinate now and follow COVID-19 guidelines. Then there's China. It has detected 40 new cases of the JN1 variant, but Beijing says it's not a matter of concern yet. In the United States, there's a similar trend. JN1 is the fastest growing variant in the country. Cases are rising, so are hospitalizations. They're up by 200%. That's hospitalizations in America, 200%. It's a steep increase, which is why the CDC has issued an alert. That's America's public health agency, CDC. It wants citizens to get boosters. The UK too is experiencing something similar. It reported nearly 6,000 cases in a week. Around 6% of Londoners are estimated to have the virus. This is 3 times higher than last month. Doctors have raised an alarm. They're monitoring all new infections. Now, I know what it sounds like. Yet another COVID wave, more cases, more hospitalizations, and the return of the masks. The signs are all there. So should you be worried? Not yet, says the World Health Organization. They say this strain is not a cause of public concern yet. The overall risk to public is low. Vaccines still offer protection, plus it's winter, the season of flu and other respiratory diseases, so it's likely that JN1 is just riding that wave. Having said that, caution is still the name of the game. The holidays are a time of happiness and cheer. Don't dampen it by sneezing all over it. Wear a mask in crowded areas. Cover your mouth while coughing or sneezing. Sanitize daily. The same old rules. Get tested if you have symptoms. Take a booster if you haven't. And if you feel ill, give that New Year's party a miss and stay at home. It's better to enter the new year safe rather than sorry.